Three things that you can do for injection site reactions. Number one, this is all informational. Please make sure that you talk to your medical team. Number one, when you take an injection out of the fridge, it can be cool and that can be really irritating to the skin. So what you can do is let it sit on the counter for just a little bit, 30 minutes to an hour, just so that it turns room temperature. Sometimes it's not as irritating. Number two, if every time you do an injection, you end up getting a little bit of like a red circle, it's itchy, it's irritated, right? So you don't end up getting fever, chills, you don't end up getting an infection, but you don't feel good, you have that local irritation, you can pre-treat with an antihistamine. So for example, something like cetirizine, which is Zyrtec, you could take that the day before and the day of, and your reaction might go down because you're helping that allergic response. Thing number three is that when you get that, it's not fun with these reactions because you're sitting there, you're itching, it's disruptive. Some people, it disrupts their sleep. So if you weren't able to pre-treat, you could take the antihistamine after, or like Benadryl at night, things like that. But the other thing that you can really do is that you can put on topical, you can buy some anti-itch cream, you could buy something that either has Benadryl in the cream or something that has hydrocortisone over the counter. You can put those creams topically on. So not only have you taken by mouth something that's going to stop the internal reaction, but also on the outside, these things can help to mitigate how bad the response is. I do see clinically with most patients that these responses tend to get better over time. I know that's totally counterintuitive. It tends to be quite random when they show up. Someone might be month 8 on treatment. They're like, why am I suddenly getting these when I didn't get them before? If they're able to stick with it, typically it gets better. Always make sure that you talk to your medical team because I want to make sure that nothing's missed. If you like information like this, make sure that you hit all the buttons and you make sure to follow for more.